Salutations, everyone, and thank you for watching episode 21. Today's episode is about keeping healthy teeth. One of the many things that we don't talk enough about in the diabetic world is gum disease. And unfortunately, diabetics who've had out of control blood sugars for long periods of time often get gum disease. And one of the most common gum diseases is gingivitis. And gingivitis is basically infected gums. Sometimes they get inflamed, sometimes they bleed. And I remember going to the dentist when I was younger, and one time the dentist told me I was going to lose all my teeth. And no doctor has ever linked that to diabetes. And I was like, doctor, I brush my teeth every day. It's not like, I don't take care of myself, but he's like, well, your teeth is really bad. So thankfully, long story short, I didn't lose all my teeth. I did lose 2 back teeth though. But now that I'm taking care of myself, my teeth is much better, and I'm just, you put your trust into doctors that, they're telling you the right thing, and I'm just, not that I'm bitter, but, I'm just so surprised that so many doctors have not caught this, and unfortunately, I wasn't smart enough to really challenge doctors and ask the questions. I put so much trust in them, and I just wish I had the awareness back then, the way I have now. Things probably would have been a lot different. But anyway, one good way of taking care of your teeth is to make sure that when you brush, you go in an up and down motion. Don't go side to side, especially if you have gingivitis, because you can actually aggravate your gums a lot more. Just make sure you just go up and down in a careful motion. Make sure that you don't use an old toothbrush. Make sure that they're very soft and they're not abrasive in any way, shape, or form. Also, when you brush up and down, you're more than likely to get whatever leftover food particles that still may be in your teeth. It's always a good idea to brush your teeth at least twice a day. Especially, even better? Especially after you have eaten certain candies like taffy, licorice, jelly beans, or even raisins, because they get, stuck in your teeth. One time, I had a raisin stuck in my tooth. I was so tired. I didn't feel like, I just went to bed after I had some raisins, and the next morning I had such a tooth pain, and I discovered that a little raisin was in the corner where I had that major tooth pain. So it's a good idea to always brush your teeth, especially when you eat those high sugary content foods. Another good thing is to always try, to the best of your abilities, especially if you're taking insulin, not to allow your sugars to get too low. Try your best not to get too many hypoglycemic episodes, because then you're forced to use these very sugary substances to quickly raise your blood sugar, and in the long run, that's not really good for your teeth. Before I go, I decided to talk about one last important subject concerning your teeth, and that is intimacy with your partner. Now, I know some of you may be saying, Yogi has flipped his lid. What the hell does intimacy have anything to do with my teeth? Well, it has a lot to do with your teeth. Now, this doesn't matter which side you're on, whether it's a man, woman, man, gay, straight, whatever. A lot of people think that oral encounters is okay. as long as you don't do it the other way. That is not true. Because if you have gingivitis and your gums are bleeding and you have unprotected oral, encounters, then theoretically, if that person has a virus or STD, which 9 times out of 10 you're not going to know unless you're smart enough to get tested beforehand. Most people don't, unfortunately. And you have these encounters with these people, and you have open sores in your gums. Now, theoretically, if that person has a virus or STD, now that virus or STD has a doorway of getting into your body through the sores of your gums. So you have to make sure that you protect yourself all the time, every time. Make sure that if you're insulin dependent, make sure that you keep a mental note of where your last injection was, so that you can make sure that no bodily fluids drops in that area. Make sure that your feet is on point, like I said before. And just be safe. It's important to be safe, guys, and be aware. And ask your doctor as many questions as you can. I hope this video has been an inspiration, and I look forward to making my next video. Bye-bye now.